Good afternoon, this is Troy with Ohio Men's Health here in Columbus. Hey, today we're going to be talking a little bit about the initial evaluation that's going to occur here with Ohio Men's Health as compared to what we call the normal testosterone mills. Now, Ohio Men's Health is a men's health practice that is designed for anti-aging. Now, anti-aging is very different than just a testosterone mill. And we're going to explain that through the evaluation that we're going to be going through with you on our first visit. And our first visit is really to take a deep dive into what kind of symptoms are you having, and then to uncork what are the contributors to it. Now, some of our other videos, we talk about the most common symptoms that men experience as we age, and we're going to start identifying some of the potential problems that we see. And these are our most common problems. Now, we're going to start with the average testosterone mill, meaning a place that you can walk in, a same day appointment, in 5 minutes, get some very simple labs. And here's the very simple labs that you're going to see. Number one is going to be a very simple blood count or thickness of the blood called a hematocrit. And the hematocrit is really just looking at the thickness of your blood as a baseline. PSA, prostate, for safety. We cannot be on any type of testosterone replacement therapy if prostate cancer is present. And the PSA is going to be screening for prostate cancer and a total testosterone, which means the total is what's in the body, which we're going to talk about the difference between the total and the free shortly. Now, a lot of people will call our practice and go, hey, I've got these labs. What would you do for me? And the question or the answer to the question is always going to be, we don't know yet. And the reason being, we need to understand this before we start getting into testosterone replacement therapy. And here's what I'm going to explain is what we're looking at and why we're looking for it. Now, let's rattle off our most common symptoms that we see with low testosterone: fatigue, brain fog, weight gain, poor exercise tolerance and recovery, decreased sex drive, sleep disturbance, decreased erection quality. Those are our most common ones. Now, all of these can be contributing factors in some regards to some of those symptoms. So what we want to do is take our time and figure out exactly which of these things can be the main contributors. Because we also see all the time that men come over after getting treated after just a very simple evaluation like this and go, I feel better, but not quite as good as I had hoped, and I'm just not quite seeing everything out of testosterone replacement therapy that I'm looking for. And the reason being, some of these can be culprits. Now, I'm also going to have another video to follow this that can talk about some of the other culprits that we're going to look at in our follow-up visit. So without further ado, let's dive into today's material. Here is our initial blood screen. Now, our first one we're going to do up here is called a hemoglobin.